Adverse outcomes of drug therapy, page number 23. From the previous page, clinical data, example hematology, biochemistry, if these records can be linked with appropriate safeguards for confidentiality and data protection, they may provide a much more powerful mechanism for assessing both the harms and benefits of drugs. All prescribers will inevitably see patients experiencing ADRs caused by prescriptions written by themselves or their colleagues. It is important that these are recognized early. In addition to the features in Box 2.11, features that should raise suspicion of an ADR and the need to respond by drug withdrawal, doses reduction, or reporting to the regulatory authorities include concern expressed by a patient that a drug has harmed them, abnormal clinical measurements, example blood pressure, temperature, pulse, blood glucose and weight, or laboratory results, example abnormal liver or renal function, low hemoglobin or white cell count while on drug therapy. New therapy started that could be in response to an ATR, example omeprazole, allopurinol, naloxone. The presence of risk factors for ADR, see box 2.8. Drug interactions. A drug interaction has occurred when the administration of one drug increases or decreases the beneficial or adverse responses to another drug. Although the number of potential interacting drug combinations is very large, only a small number are common in clinical practice. Important drug interactions are most likely to occur when the affected drug has a low therapeutic index, steep dose response curve, high fast pass or saturable metabolism, or a single mechanism of elimination. Mechanisms of drug interactions. Pharmacodynamic interactions occur when two drugs produce additive, synergistic, or antagonistic effects at the same drug target, example receptor, enzyme, or physiological system, example electrolyte excretion, heart rate. These are the most common interactions in clinical practice, and some important examples are given in box 2.12. Box 2.12, common drug interactions. Mechanism, object drug, precipitant drug, result. Pharmaceuticals. Chemical reaction, sodium bicarbonate, this is object drug. Precipitant drug is calcium gluconate, and result is precipitation of insoluble calcium carbonate. Pharmacokinetic, reduced absorption. Tetracycline, precipitant drug, calcium, aluminium, and magnesium salts. Result, reduced tetracycline absorption. Reduced protein binding. Phenytoin, aspirin, increase unbound and reduce total phenytoin plasma concentration. Reduce metabolism. CYP3A4, amiodarone, grapefruit juice. Result, cardiac arrhythmias because of prolonged QT interval. Page 418. CYP2C19, warfarin, clarithromycin. Result, enhance anticoagulation. Phenytoin, miconazole, phenytoin toxicity. CYP2D6, haloperidol, fluoxetine. Result, haloperidol toxicity. Xanthine oxidase, azathioprine, allopurinol, azathioprine toxicity. Monoamine oxidase, catecholamines, precipitant drug, monoamine oxidase inhibitors. Result, hypertensive crisis due to monoamine toxicity. Increased metabolism, enzyme induction. Cyclosporin, St. John's wort. Result, loss of immunosuppression. Reduce renal elimination, lithium methotrexate. Diuretics, lithium with diuretics. Result, lithium toxicity. Methotrexate with NSAIDs, result in methotrexate toxicity. Pharmacodynamic, direct antagonism at same receptor. Opioids, naloxone. Result, reversal of opioid effects used therapeutically. Salbutamol, atenolol. result in inhibits bronchodilator effect. Direct potentiation in same organ system. Benzodiazepines, alcohol results in increased sedation. ACE inhibitors, precipitant drug NSAIDs, results in increased risk of renal impairment. Indirect potentiation by actions in different organ systems. Digoxin with diuretics resulted in digoxin toxicity enhanced because of hypokalemia. Warfarin, as with aspirin and NSAIDs, increased risks of bleeding because of gastrotoxicity and antiplatelet effect. Diuretics with ACE inhibitors, blood pressure reduction may be therapeutically advantageous because of the increased activity of renin-angiotensin system in response to diuresis. Pharmaceutical interactions are related to the formulation of the drugs and occur before drug absorption. ACE is angiotensin converting enzyme. NSAID is non-steroidal anti-inflammatory drug. Page 23.